Good afternoon, everyone. Thanks for joining us for this afternoon's COVID-19 Professional Education Quick&R. My name is Matt McDonough. I'm going to be your host for today's event. And on behalf of CMS and the End-Stage Renal Disease National Coordinating Center, it is my pleasure to welcome you to this afternoon's event. Before we get started, I do want to note that this event is being recorded, and we typically will publish these events out on our COVID-19 Quick&Rs page within 72 hours. Truthfully, you'll probably see it there late tomorrow afternoon, but we will be publishing these within the next 72 business hours. So let's go ahead and we'll take a look at our agenda for today. Excuse me. We'll talk a little bit about what this call is about, although if you've been here before, you're probably very familiar with that. And after that, I will introduce today's speaker. We have with us Annette Hyde, who is the Facility Administrator from Quality Renal Consultants. She'll be talking to us today about COVID-19 and infection prevention. Infection prevention is a big topic going on right now with this second wave, so we're happy to have her here to speak to us today. Now, at any point during today's event, we invite you to please send any questions you may have for our speaker to us using the Q&A panel, which you'll find in the bottom of your screen. Either that or it'll be in your WebEx menu, or your chat panel, which should be displayed on your screen. As the event goes on, we will continue to monitor these questions that come in, and as time allows, at the end of our event, we will answer as many questions that we can as time allows, up to our 5:30 stop time. So please don't wait till the end of the event to submit your questions. We invite you to submit them at any time. This call has been going on for a while here. We have these weekly opportunities where we get to hear from stakeholders and peers that are in the ESRD community adapting to COVID-19. And COVID-19 is adapting to what we're doing as well. So these calls are continually important to understand what's actually going on out there in the field and how we can maybe get some examples or some real-world strategies to put into use at our facilities, our organizations, our places of business, etc. And again, these calls are weekly and they are on varying topics. So we obviously continue to hold them and hope you will continue to attend them. So now let me go ahead and introduce our speaker. It's my pleasure to introduce Annette Hyde, who is the Facility Administrator for Quality Renal Consultants, a group of independent dialysis facilities in New York City. She's a leadership committee member of North Help, which is New York City's federally funded dialysis healthcare emergency preparedness coalition. Annette has also been a practicing nurse specializing in nephrology and dialysis for over 28 years, and her experience includes hemodialysis, home hemodialysis, and peritoneal dialysis. My pleasure to turn things over to Annette.
Good evening, everyone, and thank you for having me on this call. Let me start by saying that our facility had the first reported ESRD COVID-19 case in New York City. So next slide, please. So this is a patient who is 66-year-old male. Medical history includes hypertension, hyperlipidemia, COPD, atrial fibrillation, congestive heart failure, peripheral vascular disease, and end-stage renal disease. He resides in a skilled nursing facility. So we were informed by the skilled nursing facility that this patient tested positive for COVID-19. At the time of the diagnosis, the patient was asymptomatic. He was then transferred to the hospital for further management and follow-up testing. Transferring the patient to the hospital required collaboration between the skilled nursing facility, the dialysis facility, and the emergency room, as well as the dialysis unit personnel at the receiving hospital. This is so that they can anticipate the patient's arrival and initiate their COVID-19 precautions. So the COVID-19 policies that were initiated include patient staff and visitor screening. We were fortunate to have a room right off the lobby area where patients were placed if the screening suggested COVID exposure or signs and symptoms of COVID. Dialysis staff were also trained on the necessary infection control precautions to take when entering and exiting the room. Another policy that was initiated is care of the COVID-19 positive patient in the dialysis facility. This includes infection control precautions as well as patient placement. Staff and patient infection control education, including hand hygiene, wearing of face masks, and donning and doffing of PPE. Next slide, please. So given that there are other dialysis patients who resides at the said SNF skilled nursing facility, continued collaboration with the skilled nursing facility was essential. We at the dialysis facility needed to know of any other COVID-19 testing of dialysis residents and the results of those tests. We needed to know of any other potential exposure of other dialysis residents. We needed to be informed of any patients with signs and symptoms consistent with COVID-19, and we needed to know this prior to the patient coming to dialysis. This is so we can ensure proper patient placement to mitigate further transmission while at the dialysis facility. It is imperative that a point of contact be established at the skilled nursing facility and the dialysis facility. This provides for timely and accurate information. We also collaborated with New York State Department of Health. Both the dialysis facility and the skilled nursing facility were visited by representatives from New York State Department of Health. And the purpose of the visit was to review infection control practices and protocols, as well as to provide additional infection control guidance. We at the dialysis facility were very pleased that the infection control recommendations made by New York State Department of Health were already in place. And so they provided additional guidance on patient placement and cohorting. Collaboration with the hospital was also very essential. Personnel in the emergency room and the dialysis unit of the receiving hospital were informed prior to patient arrival. This was important so that they will be able to anticipate the patient and activate their COVID-19 plan to mitigate the risk of transmission. And I am happy to report that this said patient survived COVID-19 and is currently doing well. Next slide, please. So in working to reduce the spread of COVID-19, continued collaboration with healthcare partners is important. Request COVID-19 status of new admissions and readmissions to the facility, especially if the patient has been hospitalized. We really do need to know the COVID-19 status for new admissions coming into the facility so that we will be able to appropriately place the patient. Continue with infection control measures such as hand hygiene, proper use of personal protective equipment, and proper patient placement in the treatment area. Cleaning and disinfection of environmental surfaces. This is one of our infection control practices pre-COVID. And I have to say that the existing dialysis infection control conditions for coverage were instrumental during the COVID-19 pandemic. The dialysis staff are very familiar and knew what the expectations are because this was and continues to be their everyday practice. In terms of cleaning and disinfection of environmental surfaces, I am going to suggest that we begin to take a look at our housekeeping personnel and their practice. Have they received any training on infection control, including hand hygiene and proper PPE use? Have they received any training on cleaning and disinfection of environmental surfaces? Are they aware of how to prepare and dilute disinfectant solution? And who is providing the infection control training for housekeeping personnel? The quality of housekeeping services are very important in mitigating transmission risk of COVID-19. And we continue with screening of patients, staff, and visitors. Reinforce visitors policy. No visitor or limited visitors. I say limited visitor because sometimes we will have a patient who is restless or who has dementia, and the family member sits with the patient during dialysis, to calm the patient. So this is going to be based on facilities protocol, whether or not that will be allowed in your dialysis facility. Quality review of COVID-19 facility practice is important to determine any room for improvement and any needs for practice changes. Next slide, please. So in regards to the facility infection control focus, our objective is to mitigate transmission risk of COVID-19 through the practice of patient and staff hand hygiene practices, proper use of personal protective equipment, use of face masks by patients and staff while in the treatment area, screening procedures, cohorting strategies and patient placement, patient and staff infection control education, visual audits of staff infection control practices, including PPE use. Communication of patient COVID-19 status to dialysis staff is very, very important. It is important that the patient COVID status be documented, and I would recommend on the assignment sheet to ensure proper patient placement. Next slide, please. It is very important that a review of the management and outcomes of our COVID-19 activities be conducted, and this can be done via the QAPI process. So the objective of the QAPI review may be to detect trends in the management and outcomes of COVID-19. QAPI indicators to track and trend at the facility level may include the number and percentage of patients who are diagnosed with COVID-19, and are there any new cases from month to month? It's also important to track PUI prevalence, number and percentage. It's important to track patients' residence at the time of diagnosis. Was the patient residing in a skilled nursing facility or in the community? Number and percentages of patients who recovered and how recovery was determined. Was it symptom-based strategy or diagnostic testing strategy? It's also important to track patient reinfection. Are there any cases of patient reinfection? Who is the patient and what will be our intervention? Number of expirations of COVID-19 patients. Number of expirations of COVID-19 patients unconfirmed. Staff infection control practices through practice audits. These are some of the recommendations for QAPI review that may assist us in developing better COVID-19 protocols for the future. Next slide, please. COVID-19 best practices. Establishing and maintaining community partnerships is invaluable. Communicating and collaborating with transportation companies regarding patient transport as well as infection control considerations. What are their infection control practice in regards to cleaning and disinfection of the transport vehicle? Because this will impact COVID-19 transmission if there are no infection control protocols in place on the part of the transportation company. I think it's worth looking into this to see what are they doing to prevent transmission of COVID-19. Screening of patients, staff, and visitors, patient and staff education, proper scheduling and placement of COVID-19 positive patients and PUI in the dialysis unit, cohorting strategies for skilled nursing facility dialysis patients, and of course, teamwork by the dialysis staff and patients. Next slide, please. So in preparing for a second wave, patient and staff re-education regarding COVID-19, including infection control considerations, is important. Patient and staff education regarding the facility's process in preparing for a second wave. This is important to keep everyone informed. The patients really wants to know. availability of personal protective equipment, identify critical service needs of the dialysis patient that may be affected. One of the critical needs of concern is vascular access care. During the COVID-19 pandemic, there were vascular access centers that were not accepting COVID-19 positive patients. Given that the hospitals were inundated with patients, this posed a major hindrance to dialysis patient care. So I think that vascular access centers need to conduct a readiness assessment in the event there is a second wave and address any barriers that will prevent them from accepting COVID-19 positive patients, because transferring the patients to the hospital for vascular access care may not be an option. And in fact, there are reports from the dialysis staff that they noticed that there is increased clotting of the dialyzer and blood lines for patients who are COVID-19 positive. And that alone may result in access thrombosis. So this is important. Continue with patient, staff, and visitor screening and appropriate patient placement. Communicate and collaborate with skilled nursing facility. Discussion of influenza versus COVID-19. How to proceed and how will we know the difference? If a second wave is anticipated during the fall, then a discussion regarding influenza and COVID-19 is warranted. How to proceed and how will we know the difference? And I say that because, given the similarities of symptoms for influenza and COVID-19, it is imperative that we begin to have a conversation about how we will proceed when a patient presents with such symptoms during the influenza season. Given the CDC guidance that patients with different respiratory etiologies should not be cohorted, then patients will require testing to rule out influenza or COVID-19 to ensure proper patient placement. This is an issue that is worth discussing prior to the influenza season so that we can come up with some management strategies. Next slide, please. So advice for facility staff in current outbreak areas: do not underestimate the COVID-19 virus. It is infectious and spreads easily. I recommend that you review your infection control practice protocols. Review infection control considerations for patient transportation, because patient transportation can be a mode of transmission. Reinforce patient and staff use of face masks in the treatment area. No visitor policy. Telephone screen patient at home for respiratory symptoms and fever. So we were actually calling patients at home prior to their dialysis schedule to ascertain any symptoms of COVID-19. This is so we can plan and determine patient placement in the dialysis unit. Ensure availability of PPE. Conduct inventory of your PPE and know your burn rate so that you don't run out of supplies. Proper patient placement is important to mitigate transmission. Efficient patient scheduling. Schedule patient dialysis sessions to avoid unnecessary wait times in the waiting area, pre and post treatment. Collaborate with community partners for support, guidance, and assistance. And leadership involvement and engagement is essential. Those of us who are in the administrative role, we too are essential workers. And so, if I may, I would like to thank all of the staff at Quality Renal Consultants facilities for their hard work and dedication to what we do every day. I would also like to thank the ESRD Network of New York, Network 2, Anna Bennett, for their guidance and support during the COVID-19 pandemic. We felt like we were not alone. And thank you to the NCC for giving me an opportunity to share our experience with COVID-19. And thank you all for listening. Thank you.
Annette, thank you so much for that. We received receiving questions as you've been speaking. But again, we want to echo your thanks to those who supported you as well. You've obviously had a lot of success with these strategies in your area. And so I kind of want to lead into our questions. Starting, we've got a few that come in that are about policies in your area, and then others relate to success and metrics. So let's start with a policy one, which is masking required for all of the patients in your facilities for the entire duration of their treatment in the dialysis facility, or does it even extend to beyond that, like at the point of entrance till they leave? How stringent are those requirements for you?
So I think one of the best things that we have put in place during COVID-19 pandemic is the patient and staff masking procedure. It is my belief that it was invaluable in reducing transmission of COVID-19. So our process is the patient comes into our lobby, the patient is immediately given a face mask, and that face mask, once the patient goes into the dialysis clinic, stays on until the patient leaves the facility. So that is our policy. And the other thing with the face mask is that we have to ensure that the patient wears the mask properly. Sometimes, if you're making rounds, you'll see the mask below their nose. So the staff has to provide education to the patient as to how to properly use the mask. But it is our policy and procedure that every patient and every staff wear the face mask in the dialysis facility. Yes.
Our follow-up question that came in, and I think you've kind of addressed it, is how do you deal with patients, and I'm sure there aren't that many, but that refuse to wear the mask correctly or don't know how to wear it correctly, but if you get some resistance to that?
So one of the very interesting thing about COVID-19 pandemic experience is that this is the first time that I've ever seen such patient cooperation. They cooperated. There was no resistance. They worked with us. They understood what we were doing. And I think one of the reasons is that we started our patient education pretty early. We started it in February in this particular facility. And so by the time we were faced with this patient, the patients were already, to some extent, familiar with what the expectation would be.
Right.
We started to post information on COVID-19 in our lobby, so that information was there. But in terms of cooperation, we got it. There was no resistance. And to this day, we are continuing with that process, and there is still no resistance. They are complying.
That is wonderful to hear, and this is a great segue. These are questions are kind of segueing into each other. We are in the fifth month of this, and like you said, patients are becoming more familiar with these protocols. And what we're seeing at the NCC is a lot more patients are being vocal about expressing the need for hygiene with those who care for them. Your QAPI slide shows a lot of objectives that you're striving to meet. Do you have any internal communication protocols or measurements to assess patients' satisfaction with the steps that you're taking, which are obviously very successful? I'm just curious if those are being monitored in any way.
So if we know anything of dialysis patients, is that they're not afraid to voice their opinion. And they're not afraid to tell us when staff are not adhering to infection control practice. Because our patients now, they understand now what the expectations are of the staff. And so in regards to if there is any feedback from the patients, yes, there's feedback from the patients. In fact, actually we received a letter today from one of our patients thanking our staff for the efforts during COVID-19 and in general. So I say that to mean that also the relationship that you have with your patient matters. We have to encourage the patient to voice their opinion, and we must not be punitive when they have done so. So yes, they provide information to us. If there is any complaint about staff infection control practices, that is actually discussed in our quality meeting, and that is actually written up as a patient complaint.
Thank you. That clearly answers that question. I appreciate that. We just got a question that came in, and this individual asks, or I'll just read the question. Sometimes we may encounter miscommunication between the nursing home and the dialysis center. For example, the patient in the skilled nursing facility got a check of COVID with a positive result, but the dialysis facility didn't get the update until later. Obviously, in New York, there's a lot of communication efforts going on between ERs and facilities and whatnot. How can this individual prevent these gaps in communication?
So it's very important to have that contact information for the nursing home, COVID or no COVID, right? So there has to be an established means of communication between the dialysis facility and the nursing home on a routine basis. So, so what we do is that our nursing homes actually gives us access to their EMR. We have access to view certain information. And so if we want to know, we log on to their EMR and we are able to access the lab results of the dialysis patient, including the COVID-19 testing. One of the things that we did during COVID was we met with the nursing home administrative staff to discuss our approach and strategy to COVID-19 and our expectations in terms of their communicating with us when they're testing the patients and the results of those tests. So it has to be anticipated what will happen. And the truth is, even when you anticipate, sometimes it doesn't happen the way it should. So I would say continued communication with the nursing home staff, know who the leadership staff is. But we found that getting the opportunity to access their EMR, we really do get a lot of information about the patient and their COVID-19 status from the EMR.
Absolutely. That is a level of information that maybe not everybody has, but it certainly does go a long way to addressing that situation. I think we have time for one more quick one, and this question just came in. We're going to flip back to the mask questions. And your policies and your facilities, are you allowing patients that bring their own cloth masks when they enter the building, or do they need a freshly sterilized surgical mask when entering your clinic?
When they enter our clinic, we offer them a freshly medical mask. That is our protocol.
Wonderful. I think that's exactly what they were asking, so thank you so much. We're coming up at 5:30, and that really wraps up the questions that we've gotten. So, Annette, this has been wonderful, been very informative. Thank you for sharing all of the strategies that you all have undertaken. It's been immensely informative, and we've already got questions about where can people get these slides. Again, these slides will be posted tomorrow. By close of business tomorrow, we'll have those up on our Quick&R page. But Annette, I just want to say thank you again, and we appreciate your time today.
Thank you so much. Thank you for having me.
You're welcome. We'll go ahead and wrap up. We want to talk a little bit about the kidneyhub.org, our mobile-friendly web tool for patients and professionals. Our subject matter experts at the NCC developed this in conjunction with us, and it's chock full of resources that were important to them and to patients everywhere, such as Patient Grant Library, how can patients get funding for projects and efforts that they want to undertake, informative videos, and more. So if you've not done so, please take a visit to the kidneyhub.org, check it out, and let us know what you think about this mobile tool. Our next COVID-19 Quick&R events, they will be next week. Our patient-focused event is July 14th. That is next Tuesday, 5 p.m. Eastern Time, and our provider-focused event 1 week from tonight, July 15th at 5 p.m. Eastern Time. Both of those events are available for registration already out at www.kidneycovidinfocenter.com. If you visit that page, go to the Quick&R section, and you can register, read about those events, and register for them. And that's also where you'll get the recording and the slides from today's event when we get them published tomorrow. So please be sure to check those events out and see what else we've got out there for you. On behalf of the entire NCC, I want to thank Annette and everybody who attended today for your time. We hope that you have found today's event to be informative. Our contact information is on the screen, as well as some additional resources that you can use for COVID-19 education. So thank you for attending today. We certainly hope that we'll see you on a future Quick&R event. Have a wonderful evening.